Hi, my name is Dr. Rudra Mohan, and through the Oral Health channel, today we're going to be talking about the classification or the staging of oral submucous fibrosis. Let's start. So a lot of times patients call me up and they are obviously complaining of a lot of discomfort and lack of mouth opening, that is restricted mouth opening or trismus, when they are suffering from oral submucous fibrosis. There are a lot of classifications given by a plethora of scientists about how to stage OSMF. However, just for your perusal, I feel that it should be as simple as possible. There are three ways by which you can tell if the oral submucous fibrosis is early, moderately advanced or severe. Now, it's very simple. When it comes to one classification that I found, there are two ways of classifying OSMF. Just for your simplicity, you have the clinical staging, which depends upon the presence of palpable fibrotic bands. So you have three kinds of areas where the bands are present. The fascial pillars, that's right behind your soft palate, and the curtain just right behind your uvula, the buccal mucosa, that means your cheek mucosa, and the lips. So these three areas, the fascial, buccal and oral or labial. All right, so if it's clinically stage 1, then you have only the fascial pillars having the bands. If it's stage 2, then you have buccal and fascial bands, and if it's stage 3, you have all three kind of bands: fascial, buccal and the circumoral or the labial bands. Functionally speaking, if you want to categorize it, you can categorize it as stage A, stage B, stage C. Now stage A basically is around 13 to 20 mm of mouth opening. With the help of a scale you can check between the upper and lower incisors. So it's known as maximal incisal opening, MIO. Then you have stage B, which is 10 to 13 mm, right? And you have stage C, which is less than 10 mm. So this is the functionality or the functional staging of OSMF. However, I have to tell you that there are a lot of classifications which talk about burning sensation, which talk about burning sensation to hot fluids or chilly, talk about blanching, tongue protrusion, flexibility, mobility reduction, flexibility reduction by a certain amount, and all those things. And finally, in severe cases, lesions or pre-malignant lesions and malignant lesions seen with lymphadenopathy, undernourishment and a lot of things. So that's it for today. Please like, share, subscribe and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Please kindly refrain from calling me directly, as I might be busy with patients. Just drop me a message with your name, your location and what common oral health problem that is bothering you on WhatsApp, and I'll get back to you within a couple of days. If you have any questions, queries, apprehensions, suggestions or insights, please feel free to put them in the YouTube comment section. So that's it for today. Thank you.